So now what we're going to do is we're going to use elastic wrap and an ice bag on this particular athlete's knee. So this would be immediately after the injury actually happened. The ice is going to be to reduce any initial swelling right away, help with some of the pain, and the wrap for this stage just helps hold that on tight. After this, we would then rewrap it with a compressive bandage, which I'll show in just a second. So this really, there's no major special thing with this because he's just going to be sitting here. We're not really going to have him go anywhere, so it's just holding it down. But if he gets up to walk away, that wrap is just a little bit different. So I'm going to have him kind of extend his leg here. If the injury was to the lateral side, we would isolate this ice there. If it was on the medial side, we'd isolate the ice there. Let's just assume he's got more of a patellar issue, so we're just going to put the ice directly on. Now, a lot of people question, can you put ice bags directly onto the skin? And ice bags are okay because what happens is that as the ice melts, it creates a water barrier in between the ice and the skin, which is not a freezing temperature because it's technically water. So it's safe to actually go directly onto the skin. But if it's one of those gel packs where that doesn't melt and turn to water, then you need to put a protective barrier in between whatever's cold and the skin because you can get some frostbite. So we're just going to place that directly onto there. We typically always want to go wrap distal to proximal, so I'm going to start down here. Okay. I'm just going to start to work and wrap my way up. Again, here there's not a major feature to this that I really want to focus on other than just making sure that the wrap holds secure. I don't necessarily need to do any special dog ears at this point in time because again, he's not really going to go anywhere. He's just gonna ice it as he sits here. But the key is to making sure that it's tight, it's secure, it's not too tight. So check circulation, and making sure it feels okay. Make sure you come back every few minutes and just make sure he's doing all right. After you get done, take a look, look at the skin, see if there's any irritation, because sometimes people are sensitive to cold. And they can get kind of a cold reaction, so I want to make sure that that works out okay. After he's done, about 15 to 20 minutes icing that, we're just going to take the wrap off, and then based on that, now because I want to then do some compression for him for the next 24-48 hours, I'm going to rewrap it without the ice.